Welcome to the Eastman Dental Podcast, where we hope to inspire, motivate and provide education from our guests' experience.
You may have realised that I'm not your usual regular host, but that's because today we're going to discuss the role of a specialty dentist. So Josh is a specialty dentist in restorative dentistry, and Maryam is a specialty dentist in special care dentistry.
During my undergraduate years, and I don't know if a lot of undergraduates may feel that they don't get that much exposure to special care dentistry. So this job has enabled me to get a little bit more insight into it.
The thing with being a specialty dentist / doctor is that you're not in training, so it's going to be difficult. For example, if you're not done very much oral surgery, you're not confident as an oral surgeon to then do a specialty doctor role, because you're going to be expected to be more independent than potentially other people. That doesn't mean that you're not going to be supported.
With your host, Gulshana Choudhury.
So just a little bit about, because we know a little bit about what Josh does. Maryam, is it okay if I start with you?
Sure, yeah, go for it.
So tell us a little bit about yourself, how you got to where you are today, your experiences, your education, and things like that.
Sure. So I graduated in 2016 from Liverpool Dental School. From there, I did my first year of foundation training up north in a place called Warrington, which is between Liverpool and Manchester, for those who don't know where that is. From that, I decided I actually wanted to experience a little bit of hospital, and I wanted to go down the dental core training pathway. So I did my first year at King's College Hospital, and that was in general duties, which is essentially, it encompassed a bit of experience in pediatric dentistry, restorative dentistry, oral surgery, and ADC. And from there, I then applied for dental core training 2, and I did that in Max Fax at Northwick Park Hospital. After those 2 years, I had a lot of experience under my belt, and I felt confident enough to then apply for a specialty doctor or dentist post, and that's how I ended up here. I've been at the Eastman for 2 years now as a specialty doctor in special care dentistry. For the first year, I was full-time, and at the moment, I'm part-time, and I do 3 days a week here, and 2 days as a project manager with NHS England and Improvement, working on a dental project for special educational schools.
Okay, that's great. It sounds like you've got quite a lot of experience and breadth. I mean, is that something that you've always wanted to do, like a little bit of variety in your week and your work? And is that something that you kind of enjoy about at the moment in terms of your work?
Definitely. So I think with dentistry, I do really enjoy all aspects of dentistry. The fact that I've been able to gain experience in special care dentistry through this job has been excellent, because during my undergraduate years, and I don't know if a lot of undergraduates may feel that they don't get that much exposure to special care dentistry. So this job has enabled me to get a little bit more insight into it, and actually I've gained a fonding and love for the speciality. It is very rewarding. The fact that I've been able to do the project management role as well has tied in nicely, because again, that works with children in special educational settings.
Sure.
So it's children mainly with learning disabilities and autism. So again, that's sort of also inspired me, and as a result of that, I have really sort of enjoyed being in this field.
Oh, that's great. It seems like you're doing some great work. And Josh, can you tell us a little bit about yourself, your role, and what brought you here today?
Yeah, of course. So I graduated from Cardiff University in 2017. Following that, did foundation training, the same as everybody else. I was on the Bristol scheme, although I was in Gloucester. Explain that one. With a great ES called Blake Sanders, and that was a really good year. And then I decided that I wanted to do dental core training. So I did DCT 1 back in Cardiff. That was split oral surgery restorative, with actually quite a lot of oral medicine in there as well. And I was commuting there from Cheltenham for a while, which was pretty hard. And then once I'd finished in Cardiff, I applied for DCT 2. Was very lucky to have got the restorative DCT 2 job at the Eastman, which was great. It was a really good experience. And then I was lucky to be able to stay on as a specialty doctor, which is what I'm doing now. And that's a varied role as well, talking about role variation. So I'm 2 days a week clinical in restorative, and then I'm a day a week as a hygiene and therapy clinical tutor. And then I do 2 days a week in the education centre, working on education projects. one of which is this podcast. So that's how we've ended up here.
Oh, that's great. And like you said, your role is very unique in the sense that it does combine different elements. So in your case, the restorative aspect and also the education aspect as well. So for our listeners or for people who are a little bit unfamiliar of the term specialty doctor, would you be able to explain what a specialty doctor is and day to day what exactly it entails?
Yeah, I can do my best. So essentially, it can be quite a varied role and quite a varied title. So a specialty dentist or doctor essentially is somebody who's working in the hospital that's not on a training pathway. So you're going to have DCTs in hospital, you're going to have registrars, postgraduates that are doing postgraduate education, and then the consultants. And then essentially anybody else that does clinical work in the hospital that's not on any of those pathways will be a specialty dentist or doctor. And that can range from someone like myself, which I'm actually quite junior. I don't have a huge amount of experience in restorative. Or that could be somebody who's been doing it for 20 years or might even be a specialist in one of the specialties. So yeah, I think there's quite a lot of variation within it. But broadly speaking, that's my understanding of the role.
Yep. Maryam, you kind of alluded this to earlier, especially before, but in terms of the clinical experience to actually apply for such a role, how many years are DCTs or what's expected of you in terms of the criteria to actually be able to apply for such a role?
So I don't think there's anything specific. I think it is ideal that you do have some experience, whether it is dental core training experience or potentially community dental services. So I think on average, most of the specialty doctors that work at the Eastman have at least maybe 2 or 3 years before applying for that role. But that's an average. It can be quite hit and miss, and it's dependent. Each I think applicant is different.
Yeah, I think I agree with that.
Yeah.
I think the thing to remember, or my suggestion would be, the thing with being a specialty dentist / doctor is that you're not in training. So it's going to be difficult, for example, if you're not done very much oral surgery, you're not confident as an oral surgeon to then do a specialty doctor role, because you're going to be expected to be more independent than potentially other people. It doesn't mean that you're not going to be supported. But you want to be fairly confident in, or have a good baseline understanding of whatever you're going to go into in terms of that role.
Sure. And just for our listeners, if they were to, think about going down this route or applying for such vacancies, where would you think is the best way to try to apply for these roles?
So I think most people are aware of NHS jobs. I mean, that's where I found this role. Yeah. So NHS jobs, track jobs, they generally do advertise specialty doctor roles. I'm not sure, Josh, if you know of any other.
Yeah, so I think, generally though, that's where I'd look. I think my other piece of advice probably would be to people who are already in hospital, maybe people that are doing DCT 2 or 3 and are thinking about that kind of pathway. It's just to speak to the people that you work with. Yeah. Myself, that's how I ended up with this role. And quite a lot of my colleagues who are doing specialty doctor roles ended up in that situation as well, where essentially they said, or I said to my colleagues, I'd quite like to stay here. Is there any opportunities? And then you find out, oh, actually, yeah, we've got specialty doctor roles. We've got the opportunity opening up. Something's going to happen. It's still going to go through a formal recruitment process. It doesn't mean that you're just going to be offered that job. But if you speak to people, then you might be aware of something that's about to come out that might not be advertised yet, so that when it does come out, you can apply for that. So either way, it's going to be on NHS jobs, but I think speak to people if that's what you want to do, to see what's coming up.
No, I absolutely agree with you, Josh. I mean, I've worked in max units across 2 trusts, and it's a similar situation. Like towards the end, especially most trusts, they like to take on staff that they already know, or DCTs that they're already aware of, and that they know, that they be able to progress them as individuals clinically and both professionally. So I always think it's always a good idea to ask. If you ask, you'll never know. So you never know what is out there or what could be out there for you until you ask somebody, and for it could be the role that you need.
Exactly. And in my own case, so I was DCT2, as I said, here at the Eastman. I applied for DCT3. I got offered a DCT3 role. And with my personal circumstances, it wasn't really that feasible to do that role, and it wasn't a great setup. And I just happened to say in passing to one of the consultants, actually she asked me, she said, what are you doing next year? And I said, I've got this role, but it's not really working out for me in terms of my personal circumstances. It would be better if I could just stay here. And she said, oh, well, it's funny you should say that, actually, because we're probably going to put an advert out for a specialty dentist role in the next couple of months. Why don't you consider that as an alternative? So yeah, without having that conversation, I would have accepted and I would have been on that pathway. And then after, I might have seen that advert and gone, oh, I completely missed that opportunity. So without asking, you don't get, essentially. So I think, yeah.
It's like what we were saying before in previous episodes, or like you were discussing with your previous guests, that you have to take on all the opportunities that are available to you. And I think, Maryam, were you at the Eastman earlier or before you cut to your post?
It's a similar case with Josh. So when I was in DCT2, I applied for DCT3.
Yeah.
And I think at the time I got offered a job in Max Fax again.
Mm-hmm.
So because I'd already had 1 year of experience and I wanted to experience something different. So I wasn't at the Eastman No, but I applied for NHS jobs and managed to get this job here as a full-time 5 days a week. Yeah.
And why should our listeners consider a specialty doctor role?
So specialty doctor role, as you probably all heard, is really good in the fact that it's non-training.
Mm-hmm.
It does allow some flexibility, and it does allow quite a nice work-life balance. You do work at your own pace. You've got a line manager or a supervisor who is always there, and they're always actually asking. Well, they ask. For my personal experience, I'm always asked, what do you need? What would you like to have experience in? So, for example, being in special care dentistry, I've been able to get my sedation qualification. I've had over 70 cases, and sedation is something that I really enjoy. So I've been able to ask them that, okay, please can I have a few slots in our procedure zone where I'm able to undertake sedation cases. Another examples, for example, I wanted more experience in oral surgery. And again, because we're in special care dentistry, we have a general anaesthetic list. So we do complete a lot of oral surgery, a lot of surgical extraction. So again, I've been able to do that. So all in all, it's a lot of clinical experience, a lot of clinical exposure. And I think that's really, really good. And as well as that, if you are unsure about what pathway you want to take, or maybe if you want to train, if you don't want to train, if you don't want to specialise, if you want to go back into primary care, which speciality you want to specialise in, it's the perfect opportunity to explore different specialities and see if you would like to undertake that. Because once you're in a training pathway, it's 3 years, and you're not stuck, but essentially you are kind of stuck. So it's actually really good to have or experience this kind of role prior to doing that.
I think one of the good things, or one of the great things about having a specialty doctor role, is that you're still within a supported environment. So even though technically, yes, you should be out and you should be competent and you should be able to be independent and do certain things and procedures, which is absolutely great. But at the same time, we all need a little bit of a helping hand here and there. So I always feel it's always a good opportunity to be in an environment where you can still learn, even though you're technically not in training. But again, it's about taking on those opportunities as much as possible.
I agree, yeah.
I mean, Josh, you have anything else to add in terms of selling a specialty doctor role to our listeners?
Yeah, I totally agree with everything that's been said. I think it gives you great flexibility, or certainly within my role, in terms of what I want to do and what I can offer the hospital, but also what they can offer me, certainly. I think as well, with restorative, one thing that I think's been really good is within these DCT years, the amount of treatment that you can do within a year. It's actually quite challenging, and it sounds a bit ridiculous, but some of these cases, by the time you've done the workup, you actually don't end up treating many big cases just because you don't do that much in a year. And then to be able to do a role like this where you're over a few years, you can get a lot more clinical experience. You can apply a lot more of the things that you've practiced before in reality and get that experience. And I think there's two ways of looking at it. I think either one is that it's certainly a career path in itself. And I know plenty of people that work in practice and work as a specialty doctor, and that's their plan. And that's because they've got the benefits of hospital, of being able to do complex cases, not having to worry about the costs for the patient, having the support of experienced colleagues, whilst also having the benefits of practice where, let's be honest, you're going to get paid more, and have more flexibility and more independence. So I think that's one aspect. And then the other aspect is kind of that stopgap, almost like Maryam was talking about, between DCT training and further specialty training, to get you in a position where you're, one, sure that you're definitely wanting to specialize, but also experienced. And so that when you start that specialty training, so for context, I want to do restorative specialty training. And I feel like now, after doing these 2 years as a specialty dentist, I will start at a bit of an advantage because I kind of know what I'm doing a little bit. And I think that potentially if I had gone straight into specialty training, that first year would have been finding my feet. It might have been wasted maybe. But yeah, I think there's great opportunities within the role.
So bringing it back to what you were saying, Josh, about in terms of what the role and where it can lead you, what opportunity is there for career progression? So I know you mentioned specialty training and how it's a good, it could be a good few years just to kind of build up your portfolio, gain more experience within the field that you actually want to work in, to see whether you actually have that desire and that resolve to actually stay within that field. But apart from that, what are the other opportunities for career progression that our listeners would like to know?
I think, like we've already talked about, you can get whatever you want to get out of it. So if you are wanting to get more management experience, if you speak to the consultants and say, I want some more responsibilities, I'm sure that they'll be able to give you that. And like you said, you can get your projects, you can do research, you can do audits, presentations, all of these things you've got the scope to be able to do within that role. In terms of progression, you can progress from a specialty doctor into something else. So whether you want to undertake specialty training, for example, so it's not a direct progression of that role, but it gives you the skills to be able to do that. Or you can just stay within a specialty doctor role. You don't have to go anywhere from that. And in terms of progression, you're obviously going to get better clinically. So you're just going to progress in terms of your own ability throughout that time. And actually there are some within the restorative department here, some specialty grade dentists that have been doing that for so long, they're essentially looking at getting grandfathered onto specialist lists. Now, I don't know whether that really is going to be that feasible going forward. It might be more difficult, but I think historically that was something that happened a lot because ultimately if you do 20 years in a restorative department, you're probably going to get pretty good at restorative. So I think a lot of them are proving their equivalence and they're getting their specialist status. And then also kind of, it's not quite progression, but on the same kind of lines, because you're in an NHS job, every year the pay scale, or every few years the pay will rise, so you can work through the pay scales. You might not end up with more responsibility or anything else, but you will progress in that way, so you don't have to worry necessarily about being on a low pay for indefinitely. It will progress with your experience as well.
Sure. And Maryam, you've kind of told us a little bit earlier that you work part-time and you have other roles within project management. I mean, how did you get involved with that in terms of, were you approached or did you have to apply somewhere specifically, or was it kind of done through word of mouth or networking?
A bit of both, to be honest. Yeah. So again, the job was advertised through NHS Jobs. So it was noted by myself and actually one of my colleagues who also used to be a specialty dentist in special care dentistry. And the consultant who is essentially responsible for the project does work at the Eastman herself. So we did go through the interview process, but it meant that, she knew us and was able to get a reference from the other consultants that we work with. And actually at the time, my colleague, we job shared this job as well as that job.
Okay.
And because at the time it was a full-time post, but they split it between both of us because as we're still sort of early on in our careers and we both still wanted to be involved clinically and have clinical exposure, we thought the best plan would be that we job share both jobs so that we still got our clinical experience but also managed to get some managerial experience as well.
Yeah, I think that could be quite difficult to have, especially dentists our age or in the early stage of your careers. A lot of clinical work is available out there for you, but it's trying to grab hold of those opportunities in terms of project management, leadership and things like that, which hopefully should put you in good stead going forward. Now, Josh, you've already spoke a little bit about in terms of the pay scale and what the progressions that specialty doctors can go through, but what salary are we are most specialty doctors expected to start on in pursuing such a career?
So it's widely available. People can Google it and find out. But from my understanding, with the recent change of contract, which actually was in April last year, the pay starts at 45,000 a year, and then it's pro rata obviously for part time. And off the top of my head, I'm not fully sure what that goes up to, but I think it's about 75, 80,000, something like that.
I think it depends on length of service.
Depending on experience and the length of service. So, I mean, it's not unreasonable. And I think certainly towards the latter end of that, then yeah, I think it's very good. Obviously, you've got the potential to earn more than that in practice, and that's fair enough, but it's weighing up for the person who's considering their options. So for a specialty doctor, obviously the pay is potentially greater in practice, but I think you need to look at what you want to get out of the role. For me, I think there's plenty more opportunities. There's a lot of experience that I can get within the role that I wouldn't be able to get in general practice. So I think it's kind of irrelevant. And also, even if I did want to go into practice rather than specializing later on, even if I went back into practice now, I've still got 35 years where I'd be able to do that. So I don't think that should be anyone's concern really. But it's nice to know that it's not too terrible. But yeah, that's my opinion anyway.
Yeah, I always think that you're going to be working in practice for a good proportion of your time. That option is always there for you. So if if a role like a specialty doctor role comes about, or something like you were saying about your project management or research, if that comes about, then why not take it? Just because you're going to be spending a lot of your time in practice anyway. So what advice, Maryam, would you give to our listeners who would consider a role or a specialty doctor role?
So I would say take it. Obviously, as I mentioned previously, you've got specialty doctor roles in all specialities. So it's quite important that the specialty that you choose, or if a job comes up that's, for example, neural surgery and you may be interested in it, then definitely take it. On a personal basis, I was really interested in finding out a little bit more about special care dentistry. So that was one of the big reasons why I took the job. And actually, it has given me even more of an interest to the point that I do want to, again, specialize in special care dentistry.
Oh, that's great.
So I would say seize the opportunity. It is hard work, but it is very rewardable. It's quite fun. You work in a hospital, you're able to meet colleagues from different departments. And yeah, it's a really big team, and being in a hospital is a different experience to general practice. So you do have to sort of take into a consideration that you will be working under senior provision. Now that isn't for everyone. Some people like to be their own boss. So it is about deciding how, what you want to do. Early on, I think it's difficult to be able to completely decide which pathway you want to take. And I would say as well, keep your options open, try and explore what you have or what's available, and don't narrow yourself. So for example, for myself, when I graduated, I kind of always knew that I wanted to experience hospital dentistry. I like general practice. I enjoyed my foundation training, but I did want to see what was out there and what I could do that was a little bit different. So yeah, seize the moment. If the opportunity comes up, definitely take it.
Sure, definitely. That's some great advice there for our listeners. And Josh, do you have anything to add or echo Maryam's words?
I agree. Yeah, definitely. If the opportunity comes and that's something you want to do, then definitely take it. I think the other bit of advice that I would probably give, I think it's quite hard, especially if you come in from dental core training, to get out of that recruitment cycle. We're used to September, you start a new job in September. That's how it works. You interview before that. These roles aren't within that training pathway. So it might be that a role will come available in January or April, or it will come any time. So I don't think you should necessarily be pigeonholed into expecting something to come up and you be able to take it in line with that recruitment process. So for me, my job started probably 2 months after I would have started my DCT. And then along those lines as well, because it isn't this formal recruitment process, and we mentioned NHS jobs, they're coming available all the time. Something that I still do now, although to be fair, I'm happy with my job. On NHS jobs, you can set up certain filters, and you can get email reminders or email updates of jobs that become available. So even if you're doing something else, but you think, I might consider that in the future, and you want to look at especially the dentist role, just set up the email alerts, and you'll get the emails when they come through. And one day you might get a role advert come through and you think, actually that's something I want to go for, and then go for it. So I think practically I'd probably recommend that as well. I think in addition to that, it's being prepared to get out what you put in. I think one thing that Maryam mentioned earlier was having that work-life balance and looking at colleagues that are registrars, which to be honest with you is kind of similar stuff to what we're doing. They're really busy and they've got a lot of responsibility and they've got a lot of things that they need to get done. And it's nice that we don't have that training element to bog us down or to have that extra workload. But equally, I think you can be as busy as you want to be. Yeah. So if there's an opportunity that comes up, I might decide myself to do that, and I'll decide myself to be busy and work a bit later and get that done. Whereas maybe in the training post, you wouldn't really have a choice. So I think that's another really good thing. So if you do get into the roles, just take the opportunities. And bringing it back to a lot of the other episodes, I think that's a common theme, is just take the opportunities. Mm-hmm. So I think that would be my advice.
You never know where they're going to lead you. That's
exactly.
Right. Yeah, you just don't know.
Absolutely.
So no, I think that's one of, like you said, is a recurring theme across all episodes. Any opportunities that are given to you, anything that you see, like you said, a lot of people, even in practice, they do 2-3 days in practice and then they marry that up with a couple of days in a hospital environment because they like the independence that they get in practice, but at the same time, they also like the kind of supportive environment that you get from a hospital. So exactly. I feel like in general, dentistry can give you so much variety, and I think a lot of people sometimes don't realize that. So I think, like I said, this episode hopefully would inspire a few of our listeners to hopefully go down this route.
And seek them out. I think people kind of sit in practice and think, I'd really like to be I don't know, an oral surgery specialty dentist, and then they just sit there and they don't do anything about it unless you actually go out and seek the jobs. Then it's if sometimes it's not that well advertised, it's not that easy to see where these jobs are. So if you want to do it, go out and
I think it's a great place to have a mentor as well, especially like you were saying in oral surgery. If you're not particularly confident in a certain area, there's always someone in hospital around you who's definitely a lot more senior, and they're usually very much more happy to help. So if you can get a mentor on board, I think that's probably the best thing for you to do. So going forward, Maryam, what are your plans? What's the future hold for you going ahead?
I mentioned it previously. So I would hopefully like to start training in special care dentistry. National recruitment comes up in January, so I'll be applying for that. But there's also been some academic clinical fellow posts as well, which I've applied to. So that would be the ideal plan. If that doesn't happen, because it's a very competitive process, as you all probably know, then potentially, maybe work as a specialty doctor part-time, and maybe actually go back into practice as well and do a little bit of work there. And I can just take the skills that I've got, so my sedation skills and experience with patients with so many medical comorbidities, I can take that to practice and be able to offer my services there. So that would be my plan, but we'll see what happens. You just don't know, do you?
All the best when that happens. And Josh, what about yourself? Where does the future hold for you?
Similar really. I think if you'd asked me at the end of uni what the ideal situation to be in would be, I probably would have said to be a restorative specialty doctor actually. I liked the idea. That's
interesting, actually. Because a lot of people wouldn't say that.
I actually didn't even know what specialty doctor was till
I thought it was a great idea. I was like, I can be in hospital. It's all the benefits of being in hospital without having the responsibility of being a consultant, without having the stress. And then now I'm here. I'm like, actually, no, I think I do want to do specialty training. So the plan would be to do restorative specialty training. So I'll apply again this year. I applied last year, didn't get in. I'll apply again this year. If I don't get specialty training, then I'd like to carry on here. I think, like I already mentioned, the role is split clinical, non-clinical. I actually do a lot of education stuff, which I really enjoy. So I think it would be really nice to continue that and develop some of the projects that we've been working on further.
Yeah, that sounds really great, and with all the best in your careers and your specialty training pathways. So in true Eastman podcast form, I will be reiterating the same question, Josh, that you have been giving to all of our lovely guests. So I'll actually start with you. Okay. So can you tell me 3 things that you really enjoy about your job?
3 things. I think first of all is the variety. Every day is really different. And then in a few ways, so in terms of clinical treatment, all the patients that I see, they've all been referred to the hospital. They're obviously all complex in some way, shape or form. So that's really interesting, the variety there. but also the variety I get with teaching and the other management and leadership things that I get to do within this role. So I think that's probably the first thing. I think the second thing is probably the mix between independence and support. So I think at DCT, maybe you don't have a huge amount of independence, or certainly here there's a lot of emphasis on getting things checked and making sure that you're doing the right thing, which is obviously fair enough. You're not very experienced. But now I've got into this role, sure, I'm not a specialist, I'm not a consultant, I can't just be doing these treatments all on my own, but there's that level of independence for the things that I'm confident in, I'm able to do and to take those forward. And then for the things that I'm not, I'm able to go and get that support from somebody else. So I think that mix of independence and support is really good. I think my third thing about being a specialty doctor or just working in hospital in general is having that team, that supportive team. It's really nice to be able to come in and have a huge range of colleagues from a huge range of different backgrounds. So I work within hygiene and therapy, I work in restorative. My education role gets me communicating with all the departments within the hospital, and I think that's really nice to have that. And I think I would miss that if I was in practice, that ability to work as a team and speak with different people on a day-to-day basis. So I think those are my three. I hope I haven't stolen too many of the benefits.
Mine are very similar. Personally, so the first one would be the sort of clinical exposure and, what I've been able to experience as a specialty doctor. So as Josh touched on, I've been able to do it teaching. I have been able to become more proficient in sedation. With special care, my day really varies every single day. So some days I'm in outpatients, I'm doing treatments. Sometimes I'm doing head and neck pre-assessments, so head and neck cancer patients that we see for dental assessments prior to their therapy. At times I'm doing general anesthetics, so we're all the way in the main hospital and not at the dental hospital. So it is a lot of variety. It means that I get a lot of exposure in different parts of dentistry and different parts of special care dentistry. As well as that, I've obviously been able to complete a diploma with the Royal College of Surgeons of Edinburgh in special care dentistry, and that's something that I probably wouldn't have been able to complete if I didn't have the experience of the consultants that I work with and their support. So that's probably my first one. My second one would be actually the fact that there are seniors and consultants that you can speak to. So, my team are great. I've got really, really supportive consultants, and I always get advice from them. They're always giving me personal advice with regards to, on a professional level, how to take, my pathway forward, and they often, give me insight into, what things I should improve on. And it's actually really helpful. I'm able to work quite independently, but when I do need their help, potentially with a treatment plan that might be a little bit difficult, a patient that I'm trying to figure out how to treat, then, they're there, and that's really, really, really helpful. The third thing would probably be more the sort of social element. Working in a hospital, as Josh touched, you're able to speak to and meet other people from different departments and in your own department. And I really like that side of things. It does almost feel like a family when I come to work, and I actually look forward to going to work every day because every day is like a new day and every day is a new experience. So that's probably my third one.
Oh, that's great. Like you said, every day in dentistry I always feel is always different. You never ever get the same one. And that's one of the great things about the profession. And finally, Josh, what piece of advice would you give your younger self if you could?
I think that's quite interesting. I think I mentioned earlier about me saying that the end goal would be to be a specialty dentist in restorative. And I think at that time that was really kind of pie in the sky thinking from my perspective as, oh my God, that would never be possible. So it has been possible. So I think my advice to myself would be, you can do things are possible, things will happen. Don't let yourself be put off or think that things are out of your reach or that you're not able to do. One of the consultants at Cardiff, so Rob McAndrew, in one of my meetings with him, I was average. I was literally bang in the middle of the year in terms of ranking. And he was like, are you happy with that? And I was like, yeah, I'm really happy with that. And he was like, why? And I was like, well, I'm better than half the people. And he was like, yeah, but you're worse than half the people. And I said, yeah, but I'm better than half as well. And he was like, oh, you're not aiming high enough. And I think that really,
I like that you're a glass half full kind of guy.
He didn't like that. And then the jobs that I got. So again, I was applying for DCT thinking, I'll put restorative first. That'll be great, but that will never happen. I'll never get those jobs. And then I ended up getting the jobs. And again, coming to the Eastman to do that restorative job, never would have thought I would have got that job. So every stage I'm kind of thinking, I'll try that, but it will never happen. And so if I was going to speak to myself back, I would say, don't have that thinking. Just be like, yeah, it's going to happen and it will happen.
That's a great piece of advice.
That's really good. I don't think I can live up to that.
And Maryam, exactly same question. If you could give your younger self a piece of advice, what would it be?
So I would probably tell my younger self to, follow the steps that I did. So to make sure that I do fully look around, because I think when I went into dental school, I automatically assumed that I would end up as a general dental practitioner.
Yeah.
And I don't know about yourselves, but I didn't really know about the hospital side of things. I didn't know that specialty doctor was even a thing. So I think from that point, I think dental school was quite fun for me. Yeah. I probably didn't work as hard as I should have. Maybe in the final year where I sort of pulled my socks up a little bit and made sure I did well in my finals. So I think start off from an early stage, look into what's out there and make yourself aware of what what you want to do. I know some colleagues that I've come across later on in my profession have said, oh, I've always wanted to be an orthodontist from my first year of dental school. And I said, I didn't even know what an orthodontist was. I mean, I had braces myself, but do your research from the very start, find out what's out there. And as we mentioned, all these jobs, especially hospital, they can be quite competitive and they do require certain requirements. They look for certain things. So try and tick them off if that's what you want to do. General dental practice as well. You can actually, you can go down many venues that way. You can consider a diploma or a master's. And again, it's not just hospital where, you may be able to explore different domains in general dental practice as well. So essentially, my main message would be from a very early stage, look at all your options because there are so many in dentistry that we don't really know about.
I think you both are giving some great pieces of advice. And I always think to myself, I know I'm asking myself the same question, but I always think, don't limit yourself. I think especially when you're younger, you think, oh, I can't do this, I can't do that. Don't have that mentality. Never limit yourself. And I think especially in a role such as this that you guys have both spoken about today, the more you speak to people, the more you get to know. Mm-hmm. And so I just want to thank you both for one, Josh, letting me host today's episode.
Thank you.
And two, thank you. And for being one of our lovely guests, and Maryam as well. So I wish you both all the best.
Thank you for having me.
You're welcome. And hopefully it's given our listeners an insight into the specialty doctor role, and it's hopefully a pathway that they can actually consider and are aware of in the future. So thank you both.
Great, thank you.
Thank you.
We hope you've enjoyed listening to this episode. We would love to hear your suggestions for future guests. Remember to follow us on social media using hashtag the Eastman Dental Podcast. And if you like what you hear, please like, share, subscribe, and listen out for future episodes.